The U.S. healthcare market is experiencing considerable pressure to change. And to succeed, hospitals must transform clinical support processes. There is an opportunity for quick wins that lowers costs and improves the overall care experience. One quick win is around the end-to-end management of medical equipment, which is the process of how equipment is acquired, maintained, and used throughout a hospital. But most hospital departments are unaware of the full impact equipment management has on the entire organization. Nurses often spend 20 minutes or more per shift searching for equipment, wasting thousands of hours annually and reducing direct patient care time. Meanwhile, supply chain teams respond by purchasing and renting more equipment, even though over half of the facility's existing equipment is sitting idle. And clinical engineering departments struggle with backlogged equipment repairs due to staffing shortages and rising inventory levels, which overburdens biomed technicians and distracts them from higher value work. The amount of money these fragmented processes waste and their impact on patient outcomes adds up to millions of dollars and tens of thousands of wasted hours. Fixing the fragmented medical equipment process and connecting nursing, supply chain, and clinical engineering teams is critical to improving outcomes and lowering costs. Agiliti can show you how. Individually, our on-site, rental, and clinical engineering services address process breakdowns at the department level. When combined, our services break down silos by providing an agile, end-to-end approach to equipment management that bridges the gaps between departments. This combined approach, called Equipment Value Management, or EVM, solves equipment management challenges posed by siloed departments, challenges that individual solutions cannot fully address on their own. EVM saves hospitals millions of dollars every year, savings that can be redirected for expansion, growth, or quality initiatives. Equipment value management frees nurses to spend more time with patients, which improves job satisfaction and the care experience. It provides supply chain teams with high-value business analytics, improves equipment utilization, and eliminates wasted capital and rental expenses. EVM also brings new flexibility and capabilities to clinical engineering departments to improve uptime across all equipment types, including high-value imaging and specialty equipment. Let us show you how equipment value management can lower your total cost of ownership by helping to solve fragmented processes, recover millions in wasted spending, and position your facility for even greater success.